All right, welcome back to Medical Monday.
Yes, favorite day of the week.
Yes, the favorite day of the week where we get to bring to you a health condition and also some good education that goes with it. But it shouldn't just stop with you. We always want to encourage you to like, share, so that your friends and family members can also get this good information. And maybe this week we're going to be talking about hip pain. Maybe this week you don't have hip pain, but maybe next week's condition you do have, and you want to make sure that you're caught up and you'll be able to get that notification when we do release next week's Medical Monday.
Correct. Yes. So please like this message, share this message, subscribe. And if you know somebody that has hip pain, whether it be a cousin, a friend, a neighbor, please share this message with them so they can learn how to actually better take care of that hip and get the function it needs out of it.
The big thing with hip pain is about 15% of all women and about 6% of all men will end up with this hip pain. So it's really disproportionately more often women get this than men. And it is costly.
Yes.
Osteoarthritis in America in general costs about $300 billion to treat.
Mm-hmm. It does.
But the bigger cost of that is actually lost wages.
Yeah.
So the treatments, you think about it, hip replacements like $80,000, $90,000, but yet lost wages makes up more of the financial burden. So that tells us there's a lot of lost wages.
Yeah, that's lost wages. That's me not being able to go to work because of my hip pain or recovery from what's going on. So it exceeds what it actually costs medically. That's some intense information.
It surely is.
And that right there is actually worth a share. That is worth a share.
It should be right there. Yeah. Save your cousin some money there.
Absolutely.
But you know what is the hip pain?
Yeah,
and is it very hard to differentiate between, because what do we normally see? Patients have hip pain, have back pain.
Have back pain. Patients that have back pain will describe it as hip pain. Yeah, exactly.
They kind of go hand in hand, and we always think about that old saying, which one came first, the chicken or the egg?
Yeah, well, what came first, the low back pain or the hip pain? That's why an exam, truthfully, is one of the most important aspects of diagnosing and executing a plan for hip pain specifically, is making sure that it isn't coming from the low back or that it is coming from the hip joint itself. So very important aspect.
But the hip joint itself is not as simple as we think. What about all the surrounding tissues and these multiple muscles? And that's why we have hip pain and back pain together, because muscles, they're linear. They start somewhere and they end somewhere. But in between there, they connect to two bones. So the ones that connect to your hip also connect to your back. When those muscles get real taut and tight, they're pulling on both inappropriately, and that's why oftentimes you have both conditions, hip and back pain.
Yep. And many patients you'll see, or even if you yourself experience hip pain and low back pain together, you'll notice that you're not able to quite stand up straight or tuck that butt under to get that height from straightening out. So it's because the muscles that you just described are not moving properly and they need to be stretched out. But the hip joint itself is actually a ball and socket joint. So there's a ball of bone that exists from the femur. It's called the femoral head. But then there's a socket that it sits into to allow that joint to move in a lot of different directions, just like you're seeing.
And you can see here, this little nub on the side. You can feel that on the side of your leg. That's actually what that is, that little nub right there. And then just a smidge above it, that's when you fall right into that hip space there. And a lot of times people have pain where that nub is too. There's a little bit of a bursitis issues in there of overuse.
Yes, bursitis, good old bursitis.
But when we look at the hip itself, we want to say, well, actual joint hip pain, what's going on in there and what's the cause of that?
Yeah, actually the most common problem in the hip joint itself is osteoarthritis, where you're having damage to, there we go, my finger's working right now. Damage to the cartilaginous surface on the femoral head. So that is one of the most common aspects. But there's a lot of others. We mentioned bursitis from overuse, and a lot of times from compensation as well. You'll have arthritis on one side, but a bursitis on the other. So that's very common as well.
The St. George Hospital, the rheumatology department, noted that the osteoarthritis of the hip, the number one cause of it is repetitive overload. I.e., maybe you're jumping and pounding on that space, but more likely that repetitive overload is because of obesity. So the more weight that we have, that is actually what's causing this repetitive overload onto that poor hip joint that's going to make it kind of deteriorate as we see in this picture here.
That, again, is worth a share. Again, just to point it out. I love it. So much information today.
So you've got this hip pain, whether it's the muscle dysfunction or it's a joint itself. Well, what do we need to do? What do we say? You know what? At home, what should you be doing?
Yeah, absolutely. So one you hit on, right? Sometimes overweight can actually cause some issues. But aside from that, rice it. You got to rest.
It's an acronym.
Yeah, rest. Because if you're overusing it and it's not wanting to be used, let it recover some. So rest is super important. Ice helps to get the inflammation out of the joint space.
That swelling, get it to calm down.
Yeah, absolutely.
The bigger the swelling is, the more discomfort patients have and an inability to move. You want to decrease that so that those muscles start functioning and flowing properly.
Yes. Very true. Very true. We also want to compress. Now, the hip joint itself can sometimes be kind of awkward, so there's some great ACE bandage type patterns as well as other devices that exist to help to really compress that area, to help to support it, but then also elevate those hips.
I know you love this book. I know you love this one.
I think that's so funny.
This tells me this is a neck injury right here. This poor baby is gonna have neck issues.
Wait, but he's elevating his hips.
I'm with you. It goes with the slide.
It's so cute.
That is what we want. We want to be able to elevate the injured area. However, the hip is very complex as far as how do you elevate it. Oftentimes we see that done just in a reclining chair. It's not something you're going to prop your leg up with. You actually need to be in a reclining position into a chair to be able to help with that.
Which is why recliners is usually so comfortable in a lot of these types of cases.
You hear patients sleeping in them sometimes just because the pain is so discomforting.
It's the only comfortable position they can find. So, I've gone for so long with this hip pain. I've done whatever I can at home. I've lost some weight. It's still hurting me. I can't get where I need to go. What is typically the next step, Lonnie? What do we see happening?
The last step, there's many, many, many steps that we need to have in between this step. But the last step is actual replacement of the hip. And we see this, not there, we don't.
Oh, well, pain medication, we talked about last step.
So this is a step process. So you do want to go. So the last step is a hip replacement. But to get to those, you always got to do some common therapies. We call it conservative therapies.
Yes.
Medications are oftentimes what we see over the counter is the first use that patients use. And of course, we can move into prescription ones for arthritis. We can move into some stronger ones if they don't work. They sometimes wear off. Then we move into stronger narcotics and we go down this path. And it can even go to injections. And then the last one, as we see here, is the hip replacement itself. Rather unfortunate that it got down this path, but that's just what happens. And unfortunately, if it's not taken care of, this is where we see it go.
Yes.
And this is one of the ones we talked about in the very beginning when we have that, how much does it cost to care for this condition?
Yeah.
Most of it is lost wages because this is extensive. You're out of work. You're not able to do the things you want to do just because of the recovery period.
Gotcha. Recovery time. Time is valuable. That's really the only currency that we have is our own time. And so it's very important that we value that and take care of it. Yeah. So those are some things you can do at home. Those are some things that typically are done, at other facilities. But we actually specialize in a lot of these things, right? Yep. And so there's other options out there, which is why we love doing what we're doing here. And that's to talk about other options.
Such as
rehab.
Yep.
As well as just addressing the nerve and the structures themselves. So through rehab, we strengthen those muscles that we talked about. That is it coming from the back? Is it coming from the hip? Is it coming from the back? And so it's important to make sure that we do something comprehensive to cover all of those bases. The nerves communicate to the muscles move the joints. The joint is the problem. So we've got to address all of it, making sure that we're strengthening those muscles, moving that joint, and making sure that things are moving and functioning properly. So
another part of that is we look at these decompression chairs.
Yeah.
You talked about comprehensive, and that is very important because oftentimes you get patients that are frustrated. I tried this and this didn't work, or I went to this place and didn't work. It's because it's not a magical one thing. It's a comprehensive plan to where the deficiencies, they're there. If it's just the muscle, it's not. It's the muscle, the joint, and the back. There's multiple things involved with it. And that's a good thing about having a compromising, fully encompassing plan to get the patient taken care of from all angles. Because if there's muscle dysfunction, there's going to be hip dysfunction.
Yes.
And if there's hip dysfunction, it probably came because of muscle dysfunction. So both conditions are present, and they both need to be treated.
Yes. Very, very true.
Yep.
All of that. And then there's another aspect of what we can do here, right?
There you go.
The regenerative medicine side. There is so much benefit from regenerative medicine, especially when we talk about hip itself. And so I'll let you talk about that more.
So regenerative medicine is a spectrum of healthcare to where we can take care of patients' conditions or help them heal. You know, the body itself, as we age, doesn't do a very good job of healing. Mm-hmm. You remember when you were 18, you sprained your ankle, you walked it off, and you went right back in the game. Now, well, some of us are in our 40s, and that doesn't necessarily occur.
Who's in their 40s? I'm not.
You're getting close. You're getting close.
I'm not as close as you.
But that's the thing. We know we don't heal as fast as we did when we were younger. So the great thing is with modern medicine, there's the ability to help patients along with that healing so that they can keep playing. Because just because you're 40, like I'm still active and I want to be active, and there's just injuries that occur, but they should not keep me out, and they shouldn't make me stop doing what I want to do. Very,
very true. And this is a great I love showing this clip because it's the Cryo Tank that we store the regenerative cells in.
Yeah.
So it's so cool to see that it's stored under dry ice and kept live.
Yeah. Liquid nitrogen at negative 180 degrees, just as much as any other type of live tissue. Like you may have a friend or family member that's donated sperm or has sperm being held just in case for later on in life. Those are live cells that are viable when frozen to be utilized for their purpose. Well, these cells are being kept so they can be utilized for their purpose whenever the patient needs them.
I love it. And we keep those on site. Yep. That's so cool.
That's hip pain for you.
That's hip pain, you guys. And Lonnie's over 40.
I hope you guys learned a lot. And also, like we talked about in the beginning, it may or may not be about you or even this week. Mm-hmm. We need to like and share it so we can get out to your friends, family, and then you'll also know when next week's episode is coming out.
That's very true because you know this is the best show you watch all week.
Thank you all.
You guys have a great week.
Till next Monday. Bye.